Yosha, just to make a brief speech, and then we can proceed from there. Karibu. We and Sha are like twins because we digitize Sha, and sometimes the Kenyan people don't know the difference between DHA and Sha. But see us as twins that enable one another to ensure that the Kenyan people are served and served well.
Thank you, Engineer Anjoni, for this opportunity to address the team here. I think at SHA, what we can say is that we are really benefiting in terms of the thinking of this Taifa Care initiative to be able to have end-to-end digitization of the claims processes. When we came in, the panel before was sharing really the way forward and what this will look like. And I'd like to borrow the remarks of Dr. Moi. Once upon a time in Kenya, there was very little visibility of when a patient would walk into a hospital, the services that they would get, the lab work that would be done, the treatment protocols that were issued, and then the discharge of the patient, and even the follow-up of the patient. But with our collaboration with the Digital Health Agency, we now have back-to-back full-end visibility of a patient and a patient's journey. And if we look at what is coming up next, what is left undone, which we are working on, is that every Kenyan will be able to have access to their record of services. It means you as a Kenyan will be able to know in January you went to the hospital, 2 years later in February you had your CT scan, 3 years later you went in for this surgery, and that really is monumental for us. One, as we adjudicate claims, but two, for you as a patient, as we make sure that you get quality health services. And then for us in SHA, our partnership in DHA continues. And really, if you look at the work that has been done from the inception of this program to date, we're extremely pleased and there's more to come. As highlighted by Engineer Anthony, in the last few weeks, we've already activated key technological solutions. One is biometrics, and as we continue rolling out and reaching our lower tier hospitals, it means that every Kenyan will be able to protect their cover, they'll be able to access their cover, will be able to pay for the right claim. If you look at the Healthcare Workers app, again, it allows for us to ensure that you get the services that you need from a healthcare worker who is not a quack and who then has offered you a service. And so for us, we're really seeing a lot of investments in technology that have helped us and that will help deliver the dream of UHC for Kenya. So thank you, Engineer Anjoni. Thank you.
Thank you so much, my sister, CEO Shah. Waziri, now I want to welcome the World Health Organization representative to make his remarks before we proceed. Karibu sana.
Honorable Aden Duale, Cabinet Secretary for Health, PS for Medical Services, Dr. Uma Oluga, the CEO, SHA, Dr. Mercy Mwangangi, the CEO, Digital Health Agency, Engineer Anthony Lenayare, governors, county health executives, distinguished partners, ladies and gentlemen, good afternoon. On behalf of the World Health Organization in Kenya, I thank you for this opportunity to join you at this Devolution Conference convened under the banner for the people, for prosperity, and devolution as catalyst for equity, inclusion, and social justice. This side event focuses really on how digitization advances equity, justice, and inclusion, speaks to the heart of the promise. For WHO Kenya, This conference is pivotal. For us, we gather here today in Homa Bay County, not merely to reflect on progress, but to chart a bold and inclusive future for healthcare in Kenya. One that is powered by digital transformation, anchored in the conference's central theme of equity, justice, and inclusion. As we stand at this intersection of Kenya's devolution journey and its digital health revolution, we witness firsthand how digitization serves as a powerful equalizer, breaking down barriers that have historically prevented Kenyans from accessing quality healthcare services. Today, I speak not just as a representative of WHO, but as a partner deeply invested in Kenya's remarkable transformation into a global digital health leader. Let me frame the why for this side event about digital health for equity, not just for efficiency. Recently, WHO member states extended the WHO Global Strategy for Digital Health 2022-2025 to 2027, and actually even requested for a next phase for 2028 to 2033. The signal from WHO member states is clear. Digital transformation must be people-centered, rights-based, and explicitly advance universal health coverage. WHO's guidance on ethical use of AI, especially the LLMs, reinforces this imperative to deploy innovation where it measurably improves outcomes and protects populations. Regionally, we do have the WHO Afro implementation framework, which guides the countries, including Kenya, to translate this strategy into action through governance, workforce capacity, interoperability, as well as equity lens, principles that align with the devolution. For Kenya, we are very proud of the great work being done here. There is an enabling environment, very strong political leadership of this initiative, strong laws, and clear rules. Indeed, Kenya has built one of Africa's most legal foundations for digital health. The 4 pillars really matter for this conversation. One is the Digital Health Act, which establishes the Digital Health Agency and mandates a comprehensive integrated health information system. The second is the Digital Health Regulation, the legal notice number 76 of 2025. There is also the Social Health Insurance Act and the Primary Health Care Act, which links the financing and service delivery so digital tools translate into entitlements as well as access. Finally, there is also the Data Protection Act. This clarity that these legal frameworks have provided is timely and welcome. As has also been noted, we look forward to the launch of 3 strategic documents by the Cabinet Secretary, the Digital Health Agency, Digital Health Authority Strategic Plan, the Digital Health Solution Certification Framework, as well as the Digital Health Authority Standards and Guidelines. For us, these are not just policies, they are instruments for transformation. Distinguished partners, ladies and gentlemen, let me just say a few words on equity in action, especially the community platforms, data flow, and claims. As has been shown, the Kenya's 108,000 plus community health promoters brings service closer to households. The electronic community health information system now connects the community encounters to facilities and the Kenya Health Information System, thereby accelerating decisions and closing referral loops, as has been referred to. These are real equity gains for Kenya, especially in the hard-to-reach settings. On the financial end, the SHA has stabilized digital claims processing, a very essential step to turn service delivery into timely payments. Just a few words again also on the devolution advantage and counties, especially counties as engines of inclusive digitization. The devolution brings proximity needed to design for language, literacy, connectivity gaps, disability inclusion, and gender dynamics. This also, the human rights and social justice framing of today's program is therefore for us the correct lens. It measures digital health by who benefits first, not just who is already connected. For WHO, we provide 5 design tests for equity, justice, and inclusion. For us and for the global health community, before any solution scales, WHO proposes that counties and vendors must pass this test. 5 of them. 1, access. The system must work offline, and also be able to degrade gracefully on low-end devices, 2G or 3G. 2, usability. The contents in Kiswahili and relevant local languages, low literacy designs are essential for usability. 3, safety, clear clinical scope, human oversight. 4, protection as well as accountability, which logs, metrics, and user feedback loops, made accessible to counties and communities. From the discussion so far, these are already being put in place, so this is really great for the government of Kenya and the leadership. Looking forward, we want to propose some practical steps that the country needs to fully examine, learning from best practices from around the world. In this regard, we want to propose county compact for digital health. And I will just give some 3 near-term commitments. To translate the principles outlined already into practice within the next 12 months, let us agree at this conference to have 1 inclusive service charter per county for digital health, which includes the language disability features, grievance channels, uptime targets. Second, 1 certified stack for priority use cases. For example, antenatal care immunization NCDs per county, also procured against the DHA certification framework. 3, 1 protection drill per county. We ensure that, especially at this point where we have issues of hacking, we also propose as part of this compact 1 protection drill per county annually, some form of tabletop exercise, because as you will agree with me, if there is a breach in the data, it will have significant impact on the rollout of this initiative. So going forward, WHO's role and offer to Kenya will include strengthening the governance and safety, advance data stewardship and trust, scale up equity, primary healthcare digitalization, And we also provide you global platforms to align your resources and work with you on benchmark progress openly. In conclusion, let me reaffirm WHO's unwavering commitment to working alongside Kenya on this remarkable digital health journey. Together, we are not just digitizing healthcare, we are democratizing access to quality health services for every Kenyan. The future we envision is one where a mother in Turkana can access the same quality of digital health services as one in Nairobi, where a community health promoter in Homa Bay has the same digital tools as specialists in Kenyatta National Hospital, where equity, justice, inclusion are not just aspiration, but actually everyday reality for Kenya's digital health ecosystem. WHO stands ready to continue this partnership, supporting Kenya's vision of a digitally inclusive health system that leaves no one behind. Together, we will ensure Kenya's digital health transformation becomes a global model for health technology that can actually serve humanity's highest aspiration, as well as that of all Kenyans. Asante sana. Asanteni sana. Thank you.
Thank you so much. Because of time, I will invite Chairman of DHA just to say one word. DG, please come closer, and then DG to take over the program and conclude. Chairman, DHA, please.
Our Cabinet Secretary, Honorable Haden Duale, our DG Health, Dr. Amoth, WHO County Representative, Chair Health COG, digital health stakeholders, national and county government officials present, conference delegates, ladies and gentlemen, good afternoon. Welcome to Digital Health Side event. The DHA has been in existence now for 1 year. And as chair of DHA, I'm happy to report that we have navigated through both operationalizing and as we began, we are implementing in earnest the Digital Act 2023. And like we always say, we have done what we thought, much more than we could do. And we are born and we are already running. The agency recognizes its monumental role as a crucial enabler in the delivery of universal health coverage through use of technology to transform how health is delivered. In the past, the DHA, through intentional collaboration with partners, has been able to deliver digital solutions that are boldly contributing strategically towards improving how healthcare is delivered in this country. Esteemed conference delegates, investments in digital health hold great promise for transforming healthcare systems and improving health outcomes. It is our aspiration that digital health transformation will result in improved clinical experience, increased health provider satisfaction, increased accountability and efficiency, resulting in overall improved quality of healthcare. That is preventive, promotive, and curative. At the agency, we are inspired by the Japanese Kaizen philosophy towards continuous improvement. Today, we get an opportunity to reflect, that is, smile at what went right, learn from what we did not do as planned, and visualize what the future holds as regards optimal digital health transformation. Ladies and gentlemen, in conclusion, the agency is launching its first strategic plan today. This plan reflects a shared national ambition to build a resilient, future-ready, and people-centered health system. On behalf of the agency, we sincerely appreciate all who have been part of the DHA's journey. The commitment and support from Ministry of Health leadership, led by our indomitable CS, Aden Duale, has also been truly inspirational. Thank you so very much, Wasiri. Asanteni for joining us today. I now welcome our DG Health. Take over.
Thank you, Chair. Honorable CS, allow me to ride on prior established protocols because of time. The transformative journey towards digitization of health services in Kenya has begun, and great progress is already demonstrated. Coverage has already reached more than 50% of the countries, and we are on track to be able to achieve 100% coverage before the end of the year. And we are already celebrating the dividends of this investment, as clearly highlighted by the CEO of Digital Health Agency. We have reduced turnaround time for our pre-authorization processes. We have upped our fraud detection mechanism, and through track and trace, we have enhanced our capacity for pharmacovigilance and accountability in our processes. Data is the new currency, and now we are collecting real-time data. And this data is also hosted in-country, and therefore it is easy for us in terms of decision-making. This work is not only taking place at the facilities, but it's also happening at the community level. We have the electronic community health information system that also collects data at the household level. We are soon joining the League of Nations, who collect data on a day-to-day basis, real-time, rather than wait for periodic surveys conducted every 5 years, like the Kenya Demographic Health Survey. Therefore, this is the right thing to do, and for sure, it is going to have a transformative change in our health ecosystem. Allow me to invite His Excellency the Governor of Tharaka Nithi County, who is also the chair of the Health Committee at the Council of Governors, to make some remarks and thereafter invite our chief guest for the event. Your Excellency.
Thank you very much, Dr. Omoth, our substantive DG, Honorable Aden Duale, the CS for Health, and for the sake of time, all protocol observed, I recognize you all and I salute you. We are running against time because there's another event taking place here, and for that reason, CS allow me to make very brief remarks. First and foremost, I want to thank the DHA team led by Engineer Anthony. From where we sit as the Council of Governors, their partnership has not been without hitches, but it is one of the best agencies we work with, because from where I sit, DHA has gotten us from a habit that we had in Kenya, where we used to have a book called Kitabu ya Hospitali. It used to be half a book, and our patients used to carry them along with them everywhere they go. And the biggest killer of patients in Kenya was not the wrong diagnosis, it wasn't lack of medicine, it was inconsistency of health records that made doctors treat patients who are referred with the same treatment they had in the previous treatments or visits, without realizing that that was not working because there was no record. The birth of DHA from the three laws that were passed, courtesy of Kenya Kwanza, has come to resolve this problem. And our patients are very happy nowadays, walking to hospital, carrying nothing, and they find their records there, even the records of the hospitals they visited before from their previous visits, which are not necessarily the same hospitals. That is a game changer. We are looking forward to a time when a patient in Kajiado will have the need to be seen in Bagathi, and they just walk in, give their ID card, and their records will be there, with their data being correct and also protected, because that is very, very important, not just to us as a country, but also for the patients. So data protection is something that we need a guarantee on, Anthony, because that has been our biggest worry as Council of Governors. I'd also like to, at this particular time, hail you for giving us a promise to give us end-to-end visibility, which includes a dashboard for the CEC in charge of health, also the governor. And I am briefed that that system works on and off, but I'm sure with the effort you put to reach out more counties, this is an issue that will be resolved. Lastly, counties had existing systems or digital health systems. Some of them were inferior to what DHA is offering. Some of them have resistance in accepting DHA because they feel they have had an investment. But if you're giving me a Ferrari and you're telling me to crash my VW, which is very old, I would have to make my calculations whether the VW serves any purpose. We are therefore urging the county government, if you have a system that's inferior to DHA system, it does not matter how much you invested in it. If the DHA will serve, with the DHA system will serve you better, you had better take that one. With those very few remarks, it's now my humble duty to call the CS Health, and even as you comes, and let's give him a clap. Counties have committed to give free treatment in level 2 and 3 and 4, but CS urge patients also to make sure they register for SHA, because you cannot get treatment if we don't know who you are. They must register. Thank you very much.
The Chair of Health Committee of the Council of Governors, Excellency Governors and Deputy Governors, Senators, Honorable Members of Parliament, County Assembly, senior national and government officials, our partners, distinguished guests. Ladies and gentlemen, it is my distinct honor to attend this year's Devolution Conference in the beautiful county of Homa Bay, as we reflect on the theme for people, for posterity, devolution as a catalyst for equity, inclusion, and justice, social justice. I am particularly delighted to contribute to this dialogue from the perspective of health care digitization. Universal health care remains one of the most important powerful tools for advancing equity, justice, and inclusion. Yet many Kenyans, especially in the remote and under-served areas, still face barriers to timely, quality, and affordable health care. Digitization offers a unique opportunity to bridge these gaps. It is more than technology. It's a transformational tool for efficiency, for accuracy, for equitable access, for transparency, and for citizen engagement and empowerment. The Ministry of Health has made digitization a core pillar of the ongoing health sector reforms through very key initiatives, including the Taifa Care digital platform, which integrates healthcare codes, telemedicine, insurance management, facility data, and to make sure that we provide care, we prevent fraud, and we improve patient safety and experience. We are also doing community health digitization through the Smart CHAP app. Community health promoters can now register households, report illness, track maternal and child health, and make referrals, hence boosting our surveillance, our responsiveness, and our accountability to the people of Kenya. On supply chain and resource tracking, we now provide real-time monitoring of medicines, vaccines, and medical equipment, reducing stockouts, wastage, and disparity. And finally, on health financing and inclusion, using our digital IDs and mobile money to enroll vulnerable population into the social health insurance, hence enhancing financial protection and reducing unnecessary cost. Ladies and gentlemen, devolution has been a game changer in aligning health priorities with the local realities. Counties are best placed to implement innovations that meet the specific needs of their population. The Ministry of Health continues to work closely with the county governments in the rollout of digital health infrastructure at all levels. We are working with you to build capacity of health workers and ICT officers. We are working with strengthening data governance, privacy and cybersecurity, and we want to make sure, colleagues and partners, that equity is not an outcome, it is a deliberate choice. Inclusion and justice in healthcare must be embedded in our system design. We want to ensure that our platforms are accessible to persons with disability. Our platforms are available in local languages. Our platforms are gender responsive. And our platforms are affordable to all. No Kenyan should be left behind in the digital health revolution, regardless of their location, their income, and their identity. Kenya digital health transformation is here and is real. It's reshaping how we deliver care, improve efficiency, and safeguard public resources. Through the Social Health Authority, the ministry is using technology as an engine for equity, accountability, and trust. Since October, SHA has disbursed 57.7 billion to health facilities, and of these, 49.7 billion was channeled to the Social Health Insurance Fund and emergency, chronic, and critical illness, while 6.7 billion supported the primary health care fund. And let me make it very clear here. Our primary health care fund is the one that makes Kenyans to access outpatient in level 2, level 3, and level 4 free of charge by the government of Kenya, appropriated and budgeted by Parliament. When fully integrated, biometric verification will work with real-time claims processing, enabling instant eligibility checks, fast reimbursement, and accurate data, patient data across all our counties. Beyond fraud prevention, this system builds citizen trust and provides actionable insights on service use, on the trend of diseases and spending in order to allow us to make smart investment and fast response. Ladies and gentlemen, Kenya experience demonstrates that digital health innovation, when anchored in sound policy and sustained by strong political will, as shown by the President and the government, and those of us who work with him, and our county governments, we can deliver a patient-centered, fraud-resistant, data-driven health system, serving a model for Africa health resilient agenda. And in this spirit, today is a significant milestone with the launch of the Digital Health Agency Strategic Plan, alongside other guiding documents. This will serve the compass for advancing our nation's health digitization agenda. In conclusion, we reflect on the next frontier of devolution. Let us reaffirm our collective commitment to equity, justice, and inclusion through technology and a health system. The Ministry of Health stands ready to walk this journey together with all our partners, all our counties, and our communities. We will close the gap and we will open the future. With those many remarks, it's now my duty and honor to launch the Digital Health Agency Strategic Plan. Yeah. Please, let's clap for DHA.
Purchase your tracks today.
Can we get copies? You will not expect hard copies. This is digital. Colleagues are asking me where the copy, so I told them this is digital. So you get your copy digitally, online. Thank you very much.
May we appreciate the CS for Health, Honorable Laden Duale, and his team once more. A better round of applause, ladies and gentlemen. Thank you. Allow me to welcome Tabby and the band for one number as we prepare ourselves to welcome our keynote speaker, His Excellency Engineer Dr. Raila Amolo Odinga. Welcome, Tabby and the band.
Unaweza, Yesu, unaweza, hakuna kama wewe. Unaweza, Yesu, unaweza, hakuna kama wewe. Twakuinua, tunakupa sifa yoyo, unaweza, hakuna kama wewe. Unaweza, Yesu, unaweza, hakuna kama wewe. Tunakuinua wewe, unaweza, hakuna kama wewe. Unaweza, Yesu, unaweza, hakuna kama wewe. Tunakupa sifa, wewe mwaminifu, unaweza, hakuna kama wewe. Unaweza, Yesu, wewe tunakuinua, Bwana wa mabwana. inyalo duto, Rabi inyalo duto, onge machalo kodi. Ine matingi malo, ine miromo luongo yoyo, ine minyalo, onge machalo kodi. Inyalo duto, ngamalo ionge, inyalo duto, onge machalo kodi. Inyalo duto, inyalo duto, baba, onge machalo kodi. Yesu ine minyalo, inyalo duto, osiepoa.
Sidelines to please come into the main dome and take your seats. And those of us who are standing, in this area as well, please do take your seats. I also request that all the sessions that we are done with on the sidelines, kindly, coordinators, may you get all the delegates now into this main auditorium, kindly. In the meantime, Tabi and the band are on stage, and thank you very much, Latif. I am told that now you're Dr. Latif. You have done very well since this conference began. Niombe sote tulio pembeni pembeni, tujongee na tupate kuketi. Wale ambao munashughulika na sehemu mbadala kwenye mijadala mbalimbali, ni waombe muelekeze wote wahusika na washikadau sehemu hii. Tabi.
Taya mamenyo na yora ni wana no 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 ni wana no no taya yo 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 taya ana luongo ni Yesu taya manoreso gimana yo yo taya oge machielo kendo taya o wilana tengo ya ema no bende nyingi taya ana luongi nyingi mamito mito taya Osip na yo, ine milo yo na nuende. Taya, na nuende moja. Taya, ni wana nona kwenye wadila mo ine madendo ni kama. Taya, kama. Taya, alungi ni taya ni wana no. Taya, Yesu taya yo. Taya, uliniokoa bila malipo wewe ni mwanga. Mama no kao dia tero katuo taya ukima dongo kimatino bebe kwenye mano taya neo kiudo tale neo kiudo neo kiudo tale neo kiudo neo kiudo neo kiudo taya okumana ni wara nono
Since the promulgation of the Kenyan Constitution in 2010, devolution was born for 7 counties, 1 nation, Kitui County. This is west of Kitui, the Machakos Kitui entry point, 2 hours drive from Kenya's capital, Nairobi, ushering you into the breathtaking virgin lands of Kitui, a county covering 496 kilometers squared, the 6th largest in size and the 9th most populous county in Kenya, according to the Kenya Housing Population Census Report of 2019. The semi-arid landscapes of Kitui quietly conceal monumental, unexploited mineral deposits, fertile agricultural lands, a rapidly growing hospitality and tourism industry, a highly skilled youth population forming part of a resilient community, the majority being the Kamba people. Before devolution, Kitui grappled with unequal resource distribution, economic imbalances, and social exclusion of vulnerable populations, all worsened by rising youth unemployment, limited access to affordable healthcare and education, and climate-induced vulnerabilities, further widening the socio-economic divide. With this in mind, pioneer Governor Dr. Julius Malombe conceptualized the idea of dividing the county into 6 economic and investment zones, birthing the Kitui Vision for Economic and Social Transformation, KIVEST, accelerating the realization of equity, inclusion, and social justice.
We organized the county into 6 economic and investment zones. And in each of the zones, we mapped out the resource endowments. In other words, which resources do they have, which, if exploited, they can create wealth and employment for the people of that particular zone and for the county in general.
This is Zambani Rock, 8 kilometers from Kitui town. A mystical monolith giant dome, almost striking the sky, stands right at the middle of the county. From here, one can behold the entire county. To the east is the Moi Basin Investment and Economic Zone, a zone of low-lying topographies endowed with over 400 million tons of coal. To the south is the Mutomo Ikudha Kanziku Economic and Investment Zone, home to colossal limestone deposits accessed through the iconic Athi Bridge. This is the River Athi Bridge, a pivotal boundary between Kitui and Makueni counties. This magnificent bridge serves as Kitui's entry point from the port city of Mombasa. To the north lies the Chuso Mumoni Sheikuru Tharaka Economic and Investment Zone, a high-potential tourism and hospitality area that hosts the Mwingi Game Reserve, bordering the Kora National Park, Bisanadi Game Reserve, and Meru National Park. This area boasts expansive arable lands suitable for irrigated agriculture and serves as an entry point to 6 neighboring counties. To the far north of Kitui County is the George Adamson Bridge, here. To my left is the Kora National Park in Tana River County, and to my extreme left is the Bisanadi Game Reserve in Isiolo County. To my immediate left, the Meru National Park. To my right is Tharaka Nithi County. Kitui shares the River Tana border with Machakos, Embu, Tharaka Nithi, Meru, Isiolo, and Tana River counties, with Kitui and Tana River sharing the longest borderline. This expansive zoning strategy by Dr. Malombe has made Kitui an investment trailblazer in mining, agribusiness, real estate, medical infrastructure, educational institutions, and the tourism and hospitality sectors, addressing previous gaps in socio-economic disparities, limited access to essential services, and inadequate citizen participation.
In all the 6 economic and investment zones, we have huge mineral endowments which have not been exploited. I don't think we have even exploited the 10%. So there's 90% which can still be exploited.
As industrialization gains momentum in Kitui, cottage industries are mushrooming. This has led to a collaboration with the national government to establish the Kitui County Aggregation and Industrial Park, the KAIP, at Kanyonyo along the Thika Mwingi Garissa Highway.
County Aggregation and Industrial Park It's a place where investors and producers can aggregate their produce, and they take advantage of economies of scale.
This is the Sunsweet Fruit Farm products, mango juice, and the brand is Mango Love.
Agribusiness remains the county's primary economic activity, employing approximately 66.37% of the workforce and contributing to 87% of rural household incomes. However, water scarcity has been a major challenge. Dr. Malombe is rewriting this narrative through sand dam and sand well technologies, which provide climate-resilient, sustainable water sources for domestic use and irrigated agribusiness. This not only boosts food security, but also creates jobs, especially for women and youth.
We are sandwiched between Kenya's two main rivers, that is the Tana River and the Athi River. And therefore water from those two rivers can also be harnessed and be used to drive industries. And we have about 60 other rivers which emanate from the 10 mountain ranges across the county. And we have, as a county, for example, sunk boreholes. We have also erected sand dams, over 500 of them. We have about 60 samples, and we are still doing a lot more.
Further, Kitui provides agricultural extension and advisory services and hosts the Kitui Agricultural Show and Trade Fair, a vital platform showcasing modern agricultural technologies, innovations, and market linkages for farmers and agribusiness stakeholders. Road connectivity is another key enabler of economic growth. Kitui is fairly well connected by national trunk roads and has graded over 4,000 kilometers of roads, complete with bridges, concrete slabs, and drifts across seasonal rivers, easing mobility for over 50,000 road users daily.
Kitui has the necessary infrastructure. The road network is there. The standard gauge railway, I said, is there. The Lapset corridor is near. The northern roads corridor passes through Kitui, the Kibwezi Kitui. It will go through Meru to Isiolo, and from Isiolo you join the Lapset, and you can go to southern Sudan and Ethiopia.
With a revitalized healthcare system, a key development priority, Kitui has invested in promotive, preventive, curative, and rehabilitative care to improve the well-being and productivity of our people. The county now boasts 311 functional healthcare facilities, an operational state-of-the-art cancer center, an ICU, hemophilia clinic, CT scan, and modern outpatient blocks, a 70-bed newborn unit, well-equipped maternity units, rehabilitative care for patients recovering from injuries, surgeries, or living with disabilities, including essential assistive devices. Kitui is the next big tourism destination, with the adventurous Kitui tourism circuit connecting local attractions to the national tourism network, enhancing visibility and accessibility.
We are, under the leadership of His Excellency the Governor, Dr. Malombe, establishing a new circuit, the Eastern Circuit, Tourism Circuit, where tourists can move from Savo East, come out at Kasala Gate, visit the oldest church in Kenya, the Ikuda AIC Church, where the first missionaries are laid to rest, and move back to South Kitui Game Reserve, come out at Mutomo Hillplant Sanctuary for the reptile park, and also the botanical gardens.
These slow-moving waters nourish the Savo ecosystem, which is shared among Kitui, Taita Taveta, and Makueni counties, of which 46% of the park is located in Kitui County.
We are going to establish a bridge across River Tiva, which is going to be a game changer in the move.
Thank you, Tabby and the band. Let's appreciate Tabby and the band with a mighty round of applause. And may I now request our good friends, members of the Fourth Estate, kindly, slowly, security, let's be polite. Let's be polite. Slowly. Let us take our positions on my right. At the prayers.